dear learners. Today we are going to bring you a lecture entitled Behavior Change Communication for Better Health Outcomes. I am Dr. R. Padmaja, a senior scientist at the International Crops Research Institute for the Semi-Arid Tropics based in Hyderabad, India. Today I will be joined by my colleague Ms. K. Kavita, who is also from ICRISAT and is a senior scientific officer with us. In this lecture, we are going to enhance your understanding about certain methods of behavior change communication and messaging for better health outcomes. There is another video by Dr. Nivedita Narayan which actually outlines the key principles and concepts of behavior change communication. This lecture is a sequel to Dr. Nivedita's lecture. So, let us get started. I will ask Kavita to now take over to you the behavior change communication strategies and the steps.
As introduced by Dr. Padmaja, I am K. Kavita, a senior scientific officer working with ICRISAT. Let us go through the definition of communication and how it influences the individuals in the community at different levels such as cognitive, affective and psychomotor, thereby resulting in positive knowledge, attitudes and practices towards their well-being. Communication is the process of sending and receiving messages verbally or in writing. It is necessary to pave way for desired changes in human behavior and community participation to achieve predetermined goals. The aim of such intentional communication may be to bring change in a desired direction in the one who receives it. Let us try to understand what do we mean by behavior change. Behavior change is altering the way we act and react, and it also affects how we function as a whole. When it comes to improving their health and wellness, all of us or most people know what they should be doing. They understand the benefits of a healthy lifestyle and have the desire to make the necessary changes. Unfortunately, there is a disconnect between their intentions and their actual behavior, and that is where behavior change comes in. It seems so easy. You figure out what behaviors would improve your health and then you would develop plans to make those changes and progress towards your goals. You modify your lifestyle as planned and become healthier as a result. Sounds simple. In practice, however, changing our lifestyle is often a complicated challenge, as our behaviors are shaped by countless factors including our friends, family, geographic location, culture, socio-economic status, life experiences, current health status and work. Let us try to understand what do we mean by messaging as well. As explained by the World Health Organization, broadly, communication or specifically messaging is to provide information, advice and guidance to decision makers or key audiences to prompt action that will protect the health of individuals, families, communities and nations. Messages are mainly health related to create awareness so that healthy behaviors can be adopted. Depending on their how, key audiences receive health information and with whom they discuss health advice and guidance, the type of messaging will be determined. Let us now learn about human behavior. It is not easy to change the behavior of people. It is not possible to change behavior at once or in one time conveying the messages. Messages such as importance on balanced diet, personal and environmental hygiene has to be enforced many times to make communities adopt the appropriate behavior. Here we try to understand behavior change communication or communication directed towards changing behavior in bringing about changes in knowledge, attitudes and practices. As you can see from the slide, behavior is an observable action of an individual often in reaction to specific circumstances or stimuli. It is acquired and liable to change. It is usually affected by a number of factors like genetic, social norms, culture, attitude, emotions, perceived risks and benefits, etc. Coming to the definition of behavior change. Behavior change communication is an interactive process with communities. As integrated with an overall program, to develop tailored messages and approaches using a variety of communication channels to develop positive behaviors, promote and sustain individual, community and societal behavior change, and maintain appropriate behaviors. Our learning objectives for this lecture are twofold. The first one is to learn messaging as an important communication tool among rural and tribal men and women to bring changes in their knowledge, attitude and practices regarding health, and the second one is to understand detailed steps involved in conducting behavior change messaging in the field. As you see from the slide, behavior change is a process, and as you can see from the diagram on this slide, it has three components which are interrelated. They are stages of change, channel of change and the enabling factors as indicated by Wheeler. Let us go through each component one by one. Coming to the stages of change continuum, that starts with unaware, aware, concerned, knowledgeable and moves on to motivated to change, trial behavior change and sustained behavior change. And in case of channels of change, it can be either mass media, community networks and traditional media, interpersonal or group communication, or combination of these channels to drive the message. With respect to enabling factors, it has to be effective communication, enabling environment, user friendly services and accessible commodities that are required to bring about the behavior change process. Now let us walk through the steps of behavior change. There are 5 stages which are described as follows. The first one is pre-contemplation, unaware of the problem. The second one is contemplation, aware of the problem and of the desired behavior change. The third step is preparation, that is intends to take actions. The fourth step is action itself, practices the desired behavior. And the fifth one is maintenance, works to sustain the behavior change. As seen in the previous slide, there are 5 steps, and how can we progress from step 1 to step 5, and this is how we can move. The process has understanding the situation, focusing and designing your strategy, creating interventions and materials, implementing and monitoring, evaluation and replanning. Let us go over each step in some detail. The first step is understanding the situation. As you can see in this slide, the Anganwadi workers, the healthcare workers, ASHA workers work hard each day to treat and care for individuals and the families in the community. Their work on the front line is essential to keep people healthy, treat disease, prevent disease from spreading and refer serious cases to tertiary care. So, it is very important for them to develop problem statement by understanding the dynamics of health issue prevailing in their respective communities that can be addressed through communication. The next step is about analyzing the audience and setting up the objectives. The focus at this point is on identification of aspects of the demography, behavioral and lifestyle profile of the audience that will be helpful in all aspects of planning. This involves the identification of current knowledge, perceptions, attitudes, motivations as well as barriers to the adoption of behaviors, and this can be done using the ecological model. As seen in the slide, understanding the context is very important. Once you have done all this work with your message and your audience, do remember the following though, and this is crucial. Your project is part of the everyday life and the world is a complex place, and for communication especially, it is very hard to attribute impact to just one intervention, and therefore to your intervention specifically, people experience many different forms of communication coming from very many parts of their lives. This is what is known as understanding the ecology of people's lives and hence the ecological model. So, think of all the different influences on a person such as individual, family, community, national and global influences, and this understanding of complexity in people's lives has led to many community for development thinkers adopting an ecological approach. Coming to the social determinants of health, these are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies and political systems. The following list provides examples of social determinants of health which can influence health equity both in positive and negative ways. They are income and social protection, education, unemployment and job insecurity, working life conditions, food insecurity, housing, basic amenities and the environment, early childhood development, social inclusion and non-discrimination, structural conflict, and finally access to affordable health services of decent quality. The third step is creating interventions and materials. Messages that are meant to communicate health issues or affect health behavior change must clearly convey information that ensures public understanding and limits the chances of misunderstanding. Such messages should be developed with the aim to increase knowledge, change attitudes and encouraging new behavior. Development of messages directed for health behavior change should adhere to the following: message concept development, which must consider the kind of message to be conveyed, and the messages should be simple, clear and seek to offer benefits and practical solutions that meet people's needs. Let's move to step 4. The process of transmitting this information from an individual to another or group is very complex process with many sources of potential error. The meaning must be retained during the transmission of the message. There are 6 steps to help the sender of the message to be clearer when delivering the message. They include purpose and message, channel of communication, delivering the message, potential barriers and check for understanding and feedback. Interpersonal group communication is another form through which the message can be disseminated to reach the target audience, especially in the rural and tribal communities. Through the honorary government functionaries such as Anganwadi workers and Asha workers, the messages can be widely disseminated. Let's talk about different channels of messaging. What are they? From the slide we can see that there is a wide variety of old and new communication technologies and media platforms that can be used in implementing change communication. These include broadcast routes such as television and radio, audiovisual routes such as video, podcast, photography and more, print routes such as newspaper, IEC materials, posters, graphic publications and more, telephonic routes such as mobile telephones, 3G and further, short messaging system, landline and so on, digital routes such as online platforms, email based, web based, social networking platforms, online databases, audiovisual online and more, satellite routes such as satellite television and other content. Innovations, personal handheld devices, PDA and other innovations around delivery of technologies such as wind up radios, one child, one computer and many others. Convergent routes, the combination of one or more of these options such as SMS and community radio for listener input in a regular talk show. And emerging routes, the new innovations are constantly emerging, particularly in the area of multi-platform mobile plus routes such as scanning of 2-dimensional barcodes. Again, it will depend on your context and the needs of your audience. The last and the final step is evaluation, learning and replanning. This step has the following activities: measure outcomes, assess impact, disseminate results to partners, key stakeholders, the news media and the funding agencies, record lessons learned and archive research findings for use in future programs, revise or redesign programs based on evaluation findings. Finally, the effort to bring about positive behavior change in the society should involve all stakeholders: the government, the community, the health service providers, mass media and the non-governmental organizations. Sometimes people need frequent reminder and reinforcement which can be strategically delivered if all involved parties are well coordinated and willing to work towards a common goal, which is positive change of behavior to prevent health problems. Hope by now you have clarity on what BCC of behavior change communication means and how it is implemented.
Thanks Kavita for the detailed explanation about BCC and the various steps it entails. Now, I will use a case study from ICRISAT to help you better understand behavior change communication through messaging, especially for health and nutrition messaging. A methodology called KAP, which means understanding and enhancing the knowledge, attitudes and practices, was used for nutrition related health messaging in tribal communities of Telangana. KAP, as it is called, is a quantitative method where you have predefined questions formatted in standardized questionnaires that provides access to quantitative and qualitative information. KAP surveys reveal misconceptions or misunderstandings that may present obstacles to the activities that we would like to implement and potential barriers to behavior change. A KAP survey can measure the extent of a known situation. It can confirm or disapprove a hypothesis or provide new tangents of a situation's reality. It can also enhance the knowledge, attitude and practices of specific themes, in this case health theme, and identify what is known and can be done about various health related subjects. It helps to establish the baseline or a reference value for use in future assessments and help measure the effectiveness of health education activities to change health related behaviors. And lastly, it can also suggest an intervention strategy that reflects specific local circumstances and the cultural factors that influence them, plan activities that are suited to the respective population involved. Now, how to do a KAP? KAP serves as a baseline to assess nutrition knowledge levels of different categories of respondents, i.e., young mothers, pregnant women, it could be adolescent boys and girls, it can also be Anganwadi teachers and ASHA workers. It helps in co-designing and implementation of a nutrition knowledge or a health knowledge intervention through health messaging and curriculum development. KAP endlines help to assess improvements in the new knowledge through the intervention, what worked, what did not work and what are some of the lessons learned. Now, let us see an example of health messaging in progress with adolescent girls or Kishori Balikas, as you can see from this slide. Now, the case study of ICRISAT provides evidence to how behavior change communication strategy can be initiated among the communities on their health outcomes. Based on the analysis report of KAP baseline surveys, we can identify the education interventions or the messaging interventions to be given to adolescents, pregnant women and young mothers in the community. The scripts and the posters required for the messaging were prepared and translated into local language, Telugu in this case. The training programs for the enumerators was carried out and enumerators in turn trained the Anganwadi teachers and ASHA workers or the facilitators. In the next 5 slides, we present to you some tools that were and can be developed for health messaging. These include posters for display during the education session, pamphlets which are a combination of posters in small size and which were distributed to the participants as a take home message. The pamphlets were made visual so that even people who cannot read and write can understand the message. Flyers and other visual material which were displayed in the Anganwadi centers and key places in the villages were also another mode of messaging. And lastly, movie or video clips which were interesting and of small duration were also shown to the participants. Before the conduct of nutrition or health education interventions in the community, the enumerators have consulted the local governing bodies like Gram Panchayat, Sarpanch and Patel and explained the objectives and benefits of nutrition education interventions and requested for their support in making the messaging successful. After taking the appointments and prior consent from the respondents, a suitable agreed venue was selected like Anganwadi school or a Gram Panchayat office or a primary school etc. that is present in the village to accommodate the respondents. Safety measures like hand sanitization, social distancing were also taken in conducting the education sessions. Finally, the efforts to bring about positive behavior change in the society should involve all stakeholders, that is, the government, community, the health service providers, mass media and non-governmental organizations. Sometimes people need frequent reminders and reinforcement which can be strategically delivered if all involved stakeholders are well coordinated and willing to work towards a common goal. In this case, it was positive change of behavior to prevent health problems.
Please refer to the references that are given at the end of the chapter for better understanding of behavior change communication strategy.
There are also a set of videos which can be used, which will help you as examples to produce behavior change communication products. Several partners have come together, as you can see in this slide, to bring interesting and useful lectures for you. Hope you will enjoy these lectures.
Happy learning, dear learners. Thank you.